Fast food and fried items, including burgers, fried chicken, French fries, deep fried snacks, and commercially prepared fast meals, are among the most harmful dietary choices for individuals living with diabetes. These foods are typically high in refined carbohydrates and simple sugars, which are rapidly absorbed into the bloodstream, causing sudden and often severe spikes in blood glucose. For people with diabetes, whose insulin production or sensitivity is impaired, these postprandial surges place intense stress on the pancreas, forcing it to secrete large amounts of insulin to bring blood sugar down. Over time, this repeated overstimulation can accelerate pancreatic beta cell exhaustion, exacerbate insulin resistance, and make long-term glycemic control increasingly difficult, ultimately worsening the progression of type 2 diabetes. Equally concerning is the high content of unhealthy fats found in fast food, particularly trans fats and excessive saturated fats. Trans fats, often present in fried oils and commercially baked products, interfere directly with insulin signaling and promote systemic inflammation. This combination of insulin resistance, chronic inflammation, and high caloric density fosters rapid weight gain, particularly visceral adiposity, which is strongly associated with worsening metabolic control, increased cardiovascular risk, and accelerated progression of diabetes-related complications. Frequent consumption of these foods can also elevate triglyceride levels, lower HDL cholesterol, and promote the formation of small, dense LDL particles, further accelerating atherosclerosis. For individuals with diabetes, these effects are compounded, placing them at a substantially higher risk of heart attack, stroke, and peripheral vascular disease. Fast food also exerts subtle but significant long-term metabolic damage through its glycemic and lipid effects. Meals often combine refined carbohydrates, added sugars, and fried fats, creating an extreme postprandial metabolic load. These repeated metabolic shocks destabilize blood sugar control throughout the day, contributing to chronic hyperglycemia and long-term complications such as nephropathy, neuropathy, and retinopathy. Additionally, frequent intake of fast food is linked to increased oxidative stress, endothelial dysfunction, and low-grade inflammation, which further amplifies cardiovascular and renal risks. Behaviorally, fast food is engineered to be highly palatable, convenient, and habit-forming. The combination of fat, salt, and sugar triggers reward pathways in the brain, leading to cravings and repeated overconsumption. For individuals with diabetes, this makes adherence to dietary recommendations challenging, and even occasional consumption can destabilize glucose levels, undoing careful management efforts. The habitual nature of fast food consumption means that metabolic damage is cumulative and insidious. Repeated exposure silently worsens insulin resistance, promotes weight gain, and accelerates vascular injury over months and years. From a research perspective, numerous longitudinal and epidemiological studies have demonstrated strong correlations between frequent fast food consumption and increased incidence of type 2 diabetes, poor glycemic control, and higher rates of cardiovascular complications. The combination of refined carbohydrates, added sugars, and harmful fats makes these foods a potent driver of metabolic deterioration. Avoiding fast food and fried items is not merely advisable, it is essential for individuals managing diabetes. The consequences of regular consumption are profound. They accelerate the decline of pancreatic function, worsen insulin resistance, promote obesity and dyslipidemia, and significantly increase the risk of long-term, life-threatening complications. The insidious, cumulative nature of the damage makes fast food one of the most destructive dietary habits for anyone living with diabetes.